That one infection can make all the difference in the world for that one patient. And so if you think about one infection being okay, you're thinking about one potential life being lost.
There's zero tolerance for error. Everybody needs to start at the same baseline and understand that patient safety is everybody's priority.
And so what we did is took a bundle, a number of different things that we did together, and we utilized that bundle to try to reduce the infection rates. And we were able to reduce infections to zero, both in our neonatal population and in our medical intensive care patients.
The devil's in the details, and we've really focused on standardizing the placement and standardizing the maintenance of these lines and the condition under which the line is secured, and as well the daily need for the line.
We're constantly educating our clinicians around the right and the best way to deliver the care. So any new resident that comes on board, any new clinician that comes on board, before they're able to put a central line in, they have to test out in a simulation lab. It's completely standardized. If you think about it, it's almost choreographed. Every single move is the way we want it to be.
Sustaining quality is really foremost in our minds every day, and so we try to do that by working with the families and consistently having the same nurses care for those babies so that they notice little changes, whereas if they're working with different nurses every day, they don't pick up on those tiny little differences that could really indicate that something's happening with the patient.
In many of the projects that we're starting to do now, we engage patients and families as part of the interdisciplinary team. So they're a member of the team that helps design the care that we're giving.
An example might be hand hygiene, and we teach them from the beginning how very important that is to the safety of their baby.
If we're going to go to a patient area, we have to use an alcohol-based hand sanitizer, or we can wash our hands. Anytime you leave a patient area, if you take your gloves off, you have to do hand hygiene. Before you put gloves back on, you do hand hygiene. Our patients know it. We've worn buttons for a while as to tell us if we didn't wash our hands.
Having zero infection rates for even several months is quite unusual. So to sustain zero central line infections for 1 year is pretty incredible, and to get to 3 years is practically unheard of. Then when it happened, it was very discouraging for us. If we have an infection, we treat it as a critical incident. So we huddle, we pull all the information around that case, we pull the team together, and we analyze what happened with the case to see where the breakdown could have occurred. By alleviating from the staff that feeling of I did something wrong, really to it's a process issue, it opens everyone up to wanting to be part of a success and bringing concerns forward. So it's really an interdisciplinary review of that case.
When we work together as a team, our patients benefit from it. It's our job to make their experience the best and the safest.
There is a lot of pride in reaching 3 years and 3 months with no central line infections, and what that really means in real life is that many babies' lives were saved. Many babies did not experience pain from having medications that needed to be infused. Many parents didn't have to go through that emotional roller coaster of their baby maybe not doing as well one day and doing better the next. And so we strive for a zero, never event. But what really matters is what that means in reality, and that means healthy babies.
One of my thoughts for going forward with our infection prevention program is to not put a chart and have 2 infections, but to put 2 little people figures on the top of a chart. So it actually brings you back to that it is a person, it's not just a catheter, it's not just an infection.
It's really understanding that we're all in this together and we all can make a difference. And it's empowering folks to feel like they can make a difference as well as create change.
There are our neighbors, there are our sons, daughters, husbands, wives. That's who we're taking care of here. And so it really is about personalizing it to a place where you think of what kind of care would I like to receive if I were hospitalized? And that's the care we try to deliver every day.